would like to introduce you to our panel for today, and I want to thank them for their willingness to expose themselves a wee bit to this today. So we've got Joe Ford from Skye and Lochalsh. Joe, do you want to give us a wee wave? I'm not sure if everybody will be able to see you, but Joe's from Skye and Lochalsh Voluntary Organisations. We've got Yvonne Henry from Caithness Voluntary Groups. Can you give us a wee wave, Yvonne? I don't know which page you're on. We've got Karen Derrick from Voluntary Action Badenoch and Strathspey. We've got Brian Gregg from Voluntary Action Lochaber. We've got Barry Cumming, an Environmental Health Officer. Okay, Barry Cumming, Environmental Health Officer, and Patricia Sheldon, Senior Environmental Health Officer. Myself, I'm Ian McKenzie from Highland Third Sector Interface. So we're going to go to the first question, and I'm going to ask Yvonne to answer it, followed by Joe, and then any of the rest of the panel can join in. So the question is, how can we reopen halls safely for user groups and members once the restrictions have been eased? And we've had that question in, I think it's 9 times in some form or variety or another. So Yvonne, we'll kick off with you giving answers, Yvonne.
Okay, well, the first thing really is to do a risk assessment, which really does sound quite daunting for everyone. But there is very good templates out there that we can send out. In Caithness, we've sent out to all our members, and I think all the interface partners have a copy of it, which is quite simple. And the risk assessment was all designed by Acre Village Hall Association in England, and it's really quite comprehensive, but not too laborious. And also, you've just got to look at your hall and see, is it fit for opening? What would you need to get in place? Do you need your hand sanitizer pumps, marking, taping? Consider your kitchen areas. All that things are covered in your risk assessment, but there's a cost to all that as well. So for halls opening, there's quite a lot to consider. But we also have a completed risk assessment that one of our halls in Caithness have done, because they had to reopen for Cala, a nursery, under contract for a nursery. So they've got a completed one, which we've sent out to all our halls that we can give, so that everyone can see a completed version that may be helpful for them to adapt to their halls, just to give them an indication of what could go in once they look over theirs, which may be helpful for some if they find the whole thing a bit overwhelming. Is that okay?
Yeah, thank you, Yvonne. Joe, do you want to follow on?
Yeah. So along with the risk assessments, if you look at it on a higher level and ask yourself as village hall committee members, what in your village hall might cause transmission? So this is looking at things like the places where people are going to sit, where they're going to touch, where they're going to be. Look at your users and who could be at risk. There's different levels of risk depending on the groupings of people that will be using your hall. Then how likely is it that somebody would be exposed to that risk of that transmission? And then what you can do to actually mitigate and reduce that risk. And that's where the risk assessment comes in. So you look at different places like your public toilets that people may be using, your kitchen areas, simple things like, do you have leaflets in your building? Because again, these could be like where COVID will sit. So you need to look at all of these things, and the risk assessment will help you do it on a step-by-step process.
Okay, thank you. Any of the rest of the panel want to add anything to what these guys have said? No?
I think.
Okay.
Can you hear me okay?
Yeah.
Hello, this is Barry.
Yeah,
What's
go
up,
Barry.
Patricia?
You go, Barry.
No, it was just to obviously make clear to the people, to everyone here, that obviously your hall will need a risk assessment itself, covering the facilities that you're providing for the users. It's also very important to understand that the users themselves will have to undertake risk assessments, very bespoke to their specific activities, and that should be given to you as a whole committee to review and make sure that you're happy that their risk assessment covers their activities in your premises as well.
I was just going to add in there as well to what Barry was saying. It's really useful, I think, to have a look just at the minute in terms of what the hall did provide as services before COVID, and what perhaps people want to intend to use the hall after, because depending on how busy the hall might be for requests to use, it might be a quantitative decision as to whether there's a business case to reopen the hall in the first place. There is very structured guidance on risk assessments. If you're not familiar with that, there are some very useful websites. There is the Health and Safety Executive has got guidance for village halls on risk assessments. Western Isles have got a useful platform at the moment on village halls and help you design risk assessments. There is a lot of generic guidance out there on how to undertake that. So don't be daunted. I think that's always the first thing I would say. Don't be daunting if you haven't done a risk assessment before. There are tools out there. And equally, there are others like ourselves who could provide you with a steerage if you're finding certain aspects difficult.
Brilliant. Thanks, Patricia.
Ian, can I just come in there?
I'm going to direct. Sure, of course you can, Karen.
Sorry. Really, the risk assessment that everybody's talking about, and there are examples, but if it's easier to think of it this way, that you can kind of look at it like a matrix. So as Joe has already mentioned, you need to think about the risk of the place, the building that you have, and the rooms that you have in that building, the different rooms, so rooms that you're renting out, plus your kitchen, plus your foyer, plus your office if you have one, plus your toilet. So think of all the different places, think of the people who are using it, and that is the clients, the people who are coming to use the hall, the people who are running activities, but also don't forget your volunteers, any staff you may have, and the trustees who may be going in to do some of the work. And you also need to think about the activity. So that's a kind of a three-way matrix. The activity, it depends on what it is, but also then look at it in terms of, in each of those columns, sorry, I'm getting a lot of feedback. In each of those columns, look at it, assess it as to whether it's a low, medium, or high risk. Can you hear me all right?
Yeah, I can. I'm just going around trying to mute people if they've not been muted. So.
Okay, thanks, Ian. So as I was saying, it's a kind of a three on the simplest format, and risk assessments are kind of, they can be quite extensive. But in terms of you thinking of whether you're going to open at all and what you're going to look at, it does depend on whether it's a low, medium, high risk, and how you're building, your people, and your activity relating to each of those things. And if you're going to open, it's got to be safe. And you need to just be sure that you can protect people in those categories. Thanks.
Brilliant. Okay, thank you. We've got. I'm going to direct these questions to our environmental health guys. So Patricia and Barry, if you can follow up on this. A couple of questions joined together here. What health and safety measures have to be implemented in village halls prior to the reopening? And secondly, are there any specific actions required in relation to legionnaires' disease if the hall has been lying unused for like 6 months at a time?
Specific health and safety actions. I mean, really, this is the risk assessment. So you go back to the same point, and I think it's been covered. That the risk assessment is your assessment of the health and safety of people using the hall, and obviously you guys setting the hall up. So as a very generic brush health and safety, then yes, start with the risk assessment, and that will lead you into what measures you have to take, whether it's improving things like cleaning regimes, whether it's introducing one-way systems, whether it's wiping down light switches, whether it's removing equipment or items from the hall so that the space can be used specifically. But this is all part of the risk assessment. You've got to start with that first, identify what condition your hall is in, and where you have to get to make it safe for other people to use. So it's very difficult just to give an itemized list. health and safety wise, but there is obviously the risk assessment is your start at the 10 to work out exactly what issues you need to address.
Okay.
Sorry.
Barry, there's one specific question about, is there any requirement to do anything about legionnaires' disease when halls have been lying empty for a significant length of time?
Okay. Again, I can point you in the direction of the Health and Safety Executive. They have published advice on the risk of Legionella in buildings which have been closed or have been running with reduced occupancy during the COVID-19 crisis. And it's on the Health and Safety Executive's website. And if I point people in that direction, that'll, again, depending on what system you've got and what kind of usage you've had and what maintenance and that you have there, that will point you in the direction as to what measures you have to do to make sure that the water supply is safe once you get it fired back up again.
Brilliant. I don't know, Barry, if you would be able to put in a link for that website into the chat room for people to be able to pick up?
I'll give it a go, okay?
Okay. Sorry to put you on the spot. Patricia, do you want to add anything to that?
No, I think Barry's covered that, thanks.
All right, thank you. Okay, any other partners want to add anything else? Nothing? Okay. On to question 3. It's about half a dozen questions loaded together here, and I'm going to ask for Karen and Brian to address these ones, please. How do we manage footfall? That's different groups on the same day. How long should we be left between lets? What level of cleaning is needing to be done following a group being in the hall, such as scouts or cubs or something? Yeah, and yeah, that's the questions at the minute. So, Karen, go for that one.
Okay, thanks, Ian. So again, this comes back to the same things. It's looking to see what your risk assessment tells you. But basically, there are two things. You need to make sure that there is a gap between any events that you have, and you need to make sure that the cleaning is there and done after the users have gone. And you need to be careful that within the packs that are going out and that will be circulated, all of the different third sector interface support groups will have those packs and we'll be able to send them out to you. But as part of that, there is some amended hall user agreements which have a COVID overlay to them. So when you're looking at letting people into your hall, especially if, as we've said, you've got Brian or Mary leading something, then they need to have responsibility to a certain extent for all of their things they're putting in place. So they have to make sure that what they're doing doesn't breach any guidelines, recommended guidelines in terms of expiration activity. So where people are puffing and panting and maybe, in certain exercise or through playing musical instruments, etc., all that sort of stuff, singing, these activities are really high risk because of the expiration rates. So those kind of things are not recommended, they're high risk. But for other things, the person who's leading the activity should have stuff in place to ensure distancing and hygiene and so on and good ventilation, depending on what's going on. And that is great and important, but ultimately it is down to the hall trustees to be responsible for their hall, because you can be sure that if anything happens and you do get a case that's linked back to the hall, it'll be all over social media and stuff. So there's a real strong, really strong message there that the hall trustees do have the ultimate responsibility, irrespective of what agreements you put in place with the people who are using the hall. It is a collective responsibility of that management committee or board of trustees. So you need to, again, have a think about, so I think it's a minimum kind of thing of 15 minutes. I don't know if you would be able to update me on that, whether that's not a good one, but I think that it's around something like 15 minutes, and just ensuring really good cleaning systems for any surfaces that might have been touched by people coming in or going out. That includes obviously all of the toilets and any surfaces that have been touched, including door handles, etc., etc. And I think I just wanted to say in that I mean, we've all seen the stuff around the universities at the moment and these huge numbers of outbreaks. And the majority of those people, because of their age, are asymptomatic. And so there is no, they are not really exhibiting any symptoms of the disease. But it is not just limited to those groups of younger people. Somebody can be asymptomatic at any age. And I live in Granton-on-Spey in the Cairngorm National Park, and we had an outbreak not very long ago, 2-3 weeks ago. Not all of them were in that younger age category. There were people in their 40s and 50s, and almost all of them were asymptomatic, and none of them were hospitalised and so on. So you have to, I don't want to put the fear of God into people, but you just have to make sure that you're really safe. And you almost have to assume that somebody in a group coming in and out may have an asymptomatic, they may be carrying the disease and be asymptomatic. So you have to, in assuming that, you have to try and mitigate against that person spreading the disease as much as possible. And so from that point of view, groups will do their own risk assessment. Some won't be very comfortable about coming back into the halls at all, and that's absolutely fine. But if people are wanting to come back, you have to help them to ensure they're aware of the level of risk as well. I think that's probably all that I have for the moment. Thanks.
Can I come in there, Patricia? That's right.
Yeah.
Yeah, okay. I think there's a couple of things here. Obviously, in terms of the Scottish Government and the health protection nationally, we're all as individuals need to follow the facts, the guidance on facts, which is face coverings, hand hygiene. If you're not feeling well, to obviously self-isolate and get a test. And that's important. So yes, there is responsibilities if you are managing a facility to ensure that you've got systems in place to manage physical distancing, cleaning and hygiene, and to some extent track and trace. There is some relevance here for village halls, but also the people who are visiting the hall also have a responsibility as an individual to follow the national guidance of facts. So in terms of people hiring the hall, it's also for that group who are hiring the hall to also ensure that those patrons who are coming in on that group also have some relevance of health screening, so they know that if they've got to feel well, they can't come and if they're coming as a group and someone's not feeling well, they need to tell their member not to come to that group session. So that avoids the minimizing the risk of disease transmission through respiratory transmission. But in terms of the hall, yes, I mean, you should be looking, your risk assessment should clearly identify that you need to do enhanced cleaning and disinfection. That would be over and above perhaps what you used to do prior to COVID. And that is all about trying to minimize the risk from contact surfaces where the virus can survive on contact surfaces for, I think now that they're saying from a virological perspective, up to 48 hours can be a live virus on a surface if it's been a droplet from an infected person. So it's about enhanced cleaning, and a sure way to demonstrate that you're doing that as a hall committee is to have a robust cleaning schedule, have responsibilities built into that schedule as to who does the cleaning, when it's done, how often, and it's signed off, and that the person's had the training and instruction on what to do, what that means in terms of your COVID cleaning. Now that might mean to yourselves, that might mean a detergent on a cloth and wiping surfaces and then spraying a sanitizer or a chlorine-based disinfectant product. But if you have systems in place and a procedure and it's signed off, then this will put you in good stead. The frequency of cleaning, again, it's down to how you risk assess it. It is, if you can, it's obviously would be very good if you can clean between groups, but as long as you demonstrate that you've got additional routine cleaning, and the Health Protection Scotland guidance, there's a publication called Health Protection Scotland guidance for non-healthcare settings. That's a very useful document. It refers to workplaces, but it could also refer to village halls, and it gives you guidance on there about what cleaning and disinfection means and the frequency of cleaning. I think that one of the questions you just raised was how long between lets.
Yeah.
Again, there's no specific guidance on that. It really is down to the hall committee as to what you want to do in between lets to demonstrate you've got your COVID measures in place. And if you're prepared to wipe down all your contact surfaces as much as you can between different groups coming in, that's obviously a very well established gold brass approach. It is really down to your own discretion, and if you wanted to build in a timeline of 15 minutes, 30 minutes between lets, which enables you maybe to set the hall back to where it was before the group came in. That might be something that you might want to do. You might want to set out the equipment and tables, and the hirer comes in, and then the hirer leaves. You clean all the surfaces and chairs and surfaces, and then put them away again, so you know that you've done the cleaning to all the respective contact surfaces. So you might have to build that into your time between lets, how much of the responsibility you have for doing that.
Brilliant. Yeah, I will come to you just in 1 second, Brian. But yeah, I would just want to add on to what Patricia said, that in one of the halls that I'm involved with, that you can't give a definite time between lets, because it depends how many staff or volunteers you might have in at a time. So on some days, the group that I'm involved with, I've got like 5 workers in, so we could turn the hall round in about 10-15 minutes. But in a couple of days, we've only got 1 person in, and it's taken over an hour to get the cleaning done between it. So it's not about a time, it's about the function of cleaning between it. So Brian, let me pass on to you. Is there anything else you want to add to what's been said, Brian?
There's not an awful lot to add, actually, Ian. I think it's all been really well covered by Karen and Patricia. The one thing I would mention is actually seeing it as a little bit of an opportunity, if we can, in these uncertain times. A couple of groups down here in the Ardnamurchan area have been looking at almost appointing a squad of cleaners for a couple of halls that are not too far away from each other, and either buying in or hiring in the fogging equipment that I'm sure a lot of premises have heard of over the last few months, and doing a deep clean. And that doesn't address the question of between the lets, obviously, because you can't do that sort of deep clean with the fogging equipment in between sessions, but it can be done on an overnight basis or on a weekend basis. And they're actually looking at accessing some of the funding that's available for recovery, for COVID recovery, to hire in that equipment and to potentially pay people where they're not able to get volunteers. So it's just something else to bear in mind, and that's really going to assist with the cleanliness. And as I say, it's that real deep clean, because you can't necessarily be sure that everything's been achieved with your wipes and disinfectants and so on. It does seem like maybe a sort of sledgehammer to crack in that approach, but yeah, I suppose you could take the better safe than sorry angle, and there is funding available for that in some cases.
Yeah, thanks, Brian. I will come back to funding and equipment and things towards the end of this. We've got a couple of questions right at the very end, and maybe a couple of suggestions for people there. So this one may have been answered already. Brian, I'm going to ask you and Joe to go to this one, but it may well have been pretty much covered already. Having gone through the risk assessments, there are still a number of items that are left open to interpretation. How do we make sure that my interpretation is right? And another one was, risk assessment is really daunting for some of us who have never done this sort of stuff before. Is there any external help that can help some of us to complete a risk assessment? So Brian and Joe, you go ahead with that one.
First thing I would say, having come from a teaching background and being risk assessed up to the eyeballs for taking children into the playground sometimes, there are no daft questions. That's the first thing to think about risk assessment. People do have to take them to the nth degree as to what could be the worst possible case scenario. And oftentimes you will look at it and think there's no way this could possibly happen. You have to make sure that you've at least legislated for that. So that actually speaks in some ways to the external help with this. your local voluntary sector organisation is a great source of information for that. We deal with risk assessments all the time for groups, from gardening groups to Scrabble for, you know, adult learning difficulties and so on. There's everything is pretty much covered, and you can rest assured the question has probably been asked before. So it is a daunting process, but I think the key to risk assessment is just thinking about what is the worst that could happen, and if we can mitigate for that, taking into consideration some of the things that Patricia mentioned in terms of those mitigation factors for cleanliness and gaps between groups and so on. If we can think about what's the worst that could happen and mitigate that, then everything else will feel less daunting if you know you've covered the worst aspects of it, if that makes sense.
Joe?
I'll just follow up with the help for carrying out risk assessments. The panellists that are here today are all rural partners of the HTSI, and the HTSI themselves, we all deliver support services to local community groups. So if a village hall needs help in looking at a risk assessment and how they approach it, then what I would say is come to us, because we'll be able to help. I cover Skylock, Alsham, Wester Ross. So if your village hall is in that area and you'd like to have a chat, then what I tend to do with groups in this COVID situation, we'll arrange an online meeting where we can facilitate that conversation and help go through those risk assessments, because you're the people who know your halls and know what happens in them, and we can ask the questions to get you to where you need to be to complete those risk assessments. And we can do that online in a meeting, and it may be over a couple of meetings. We've got no time periods on this of how we support you, but come to one of us and we'll be able to help.
Thanks, Joe. When we circulate we note of this meeting, I'll make sure that we put in all of the email addresses of all of the partners that are on here today, so you can have a direct contact in your area, because I mean we've got somebody operating in every area of Highland, so we'll get these email addresses and locations out to each of you. Yeah, Brian, go on.
Can I just go back in quickly? There's one thing I was going to say about risk assessment. Something I found useful doing them myself is to try and, I know it's not always possible, try and ask someone to look over your risk assessment who's not familiar with your organisation and not familiar with your operating practices. They are more than likely to spot something that you would normally just gloss over, or that it becomes second nature to you, and they might be the one to ask the question, you know, what about X, Y, and Z? Always good to get a pair of eyes from out with the organisation, and possibly that's even easier in COVID times, because you could just ping someone an email with your document.
Brilliant. Thanks, Brian. Okay, I'm going to move on to the next question, and I'm going to ask Yvonne and Barry if they would be up for answering this one, please. We have a number of user groups who use the second kitchen facilities to make their tea and to have a break. Our idea was, if we are going to open, that we'll suggest that they take in their own packed lunches with them, and that they eat outside, or that they eat in the room that they're hired, but they don't use our crockery or utensils or kettles, but they bring their own flasks and tea and things with them. Would that be enough to mitigate against sharing facilities but allow people to eat?
Yeah, sure. In Caithness, that is what's happened with halls that have opened. They have done the risk assessment and decided just to close their kitchen because it's too high a risk with shared crockery and cleaning and keeping up with rigorous standards. So they've risk assessed and decided that hall users that do want to have the cup of tea to take it in with them, and their flasks and their food, and to use it only in that hall, the room that they have hired. So there is no risk of them cross-contaminating people going to kitchen. It's just mitigating risk. It's just judging what they can do, and they've decided that if halls, they do wish to have food in the hall, that's the way to do it. And also they must empty their bins after them and dispose of any rubbish and litter, so it's not left in the hall. So it's just a way they've decided not to allow groups to access the kitchens. And that seems to be working okay. The user groups that have used the halls, they don't have a problem with it, they understand. So it hasn't really caused any issues. It's just a way of looking at how they can manage to allow the users in, but as safely as possible.
Okay, thanks, Yvonne. Barry, do you want to come in on that?
Yeah, sure. Just to agree there with what Yvonne had said. You know, the risk assessment is obviously the halls that you've been speaking to have obviously made the risk assessment and decided that it is too high a risk to use the kitchen. Obviously, you could risk it out and say that you're going to do X, Y, and Z to clean a kitchen, but probably in most instances, given the risk associated with the reusing of food, knives, forks, stuff like that, if you don't have dishwashers and all that sort of stuff in place, then in the absence of a very specific cleaning protocol for a kitchen, if someone was going to use it, then preventing groups from using the kitchen and providing their own cutlery, utensils, their own food, that sort of stuff is certainly a good idea.
Thank you. Okay, thank you, guys. Let's go to Joe and Karen for the next one. Given that indoor markets have been allowed for some time, are there any special requirements to permit indoor markets in village halls? And I'm just going to pile a whole pile of other things into this one as well. What about one-off events? What about using halls for local consultations? Can we use a hall for an open exercise class if we follow government advice? And what about holding outdoor events at the hall? Joe or Karen, you want to lead away with that? Joe, you start. Yeah.
Okay, so there's no specific, as everyone knows, the sector is huge and all the activities that happen in halls is wide and vast, and there's no specific advice that people, the government have given, because there'd be hundreds of different trains of advice. So when you're looking at doing one-off events, then what you need to do is, can you do it safe? And it's risk assessing again. So if it's the NHS, I know the NHS are using some of the halls for the flu vaccinations, they will have their own protocols in place, and you can be quite reassured that those protocols will be very stringent and very strict. But what you need to do is look, do they fall in with your hall as well? Because as Karen said, it's the committee who are ultimately responsible for what happens in that hall. The other thing is, one-off events may be like a community consultation. Again, you need to look at it. Can you keep people safe? Can you keep that social distancing? And are you able to clean down in between? Maybe people going in. A good thing, if you're at a hall and you've got two external doors, then one way in, one door out. Very simple things that stop people crossing. You know, so it is again, we're all saying it, it's down to the risk assessments, but it truly is, and it depends on the event. The exercise classes, I don't know whether Karen, when Karen was saying anything that makes you puffy and active, I'd say you've got to really consider that, because the risk of infection is higher. But if it's, I don't know, a reading club, a book club, then it's significantly lower. But these one-off events and markets, I've got to say that personally, they do concern me and worry me, because it's how can you ensure that really stringent cleaning and also that infection control. You know, if you're moving from one stall to the next, people are picking things up, putting things down. So it's very much do that risk assessment. And I've been looking online to see if I can find any guidance, and I haven't been able to, but maybe Karen has it. So I'll hand over to Karen.
Thanks, Joe. No, I haven't found anything specifically on this, and I agree with everything you've said. As I say, I would have said indoor markets are probably something I would classify as a more high-risk activity because of the numbers. And, you know, if you're running an indoor market, you want people to come and buy. So it's like any of the things any businesses are looking at. How viable is it? In terms of government guidelines, in terms of social distancing, keeping people apart, allowing a maximum number of people into the building at any one time. I think you need to be really careful about that, about the flow of people if you've got an event like that. All of these things would, to me, signal that that is a very high-risk event. And as Joe has said, you need to, if you're going to do that, you need to be sure that it's going to be safe. And so I think if you are considering opening your hall, or maybe if it is open just now, you need to start, I would say, with the low risk activities and build up your confidence, build up all the things that Patricia very ably outlined earlier in terms of the systems you need in place for cleaning, right through the numbers of people that you have, the amount of time that you have, the amount of space that you have to clean. So my advice, for what it's worth, is start with your low risk activity and build up so people have some confidence in the hall. And until we know a little bit more about what we're going into in the autumn and winter period, I would actually probably steer well away from the medium and high risk activities. It's just not worth it. In terms of exercise classes, some of the halls may be opening for schools, for gym classes and so on. They may traditionally have always used the hall for that kind of activity. And the guidance is really clear that for under 12s, they're considered to be a low risk group. And so contact and non-contact sport is permitted for under 12s. For over 12s, it's non-contact only. So if you're thinking of running any kind of exercise class, again, consider what type of activity it is, how much huffing and puffing it is there, because that will immediately put it into a higher risk category. But in any case, even if it is just reading a book, not a steamy novel, so you're not going to be huffing and puffing. But you still need to have all the things we've mentioned in place around making sure you maintain. Sorry, Ian, obviously, maintain physical distancing, the 2 meter distancing in how you set your activity out. Making sure there's adequate ventilation as much as possible in your hall. That means windows and doors open if you possibly can, to make sure there's a through flow of air, hand sanitization, etc., and a deep cleaning or a full cleaning regime for any surfaces that have been touched. I think that was all that you asked from us. So basically, you just have to work out how safe is it to be in that room, and how can we mitigate that. Thanks.
Brilliant. I never thought of a Julie Cooper novel being something that would put me at risk. Not that I've ever read a Julie Cooper novel, I need to say. Okay,
so the Julie Cooper was from you, not from me.
Okay. Okay, let's go with this one to Brian and Yvonne. Yes.
Patricia here. Can I just come in on a couple of points just on that last one? Just because of recent experiences, really. The first one would be obviously you need to keep an eye on what are current restrictions, and we might well be in a situation where things have been able to be given the green light, and then the Scottish Government might well put the brakes on. So it's important for anything you're considering that you pay close attention to what is being restricted, but also I think more important than that as well is the fact that if you are thinking of something that's not a usual kind of let, it's something outside of the box, just have a real consideration. I know we're all community spirited people, but it is the community we're there to protect. We are working with the community, and some proposed events that have been discussed in some communities have caused quite alarm. So it is about just being aware of how everyone is feeling at the minute and an anxiety levels, and whether something that you might think might be really good for the hall, might bring in some profit or bring in further hiring, it might not really sit at this point in time as a good idea in terms of trying to control COVID.
Patricia, you just give me a seamless link into the next question. Thank you very much. So the next question is, we regularly have university groups using our hall as a base for weekend trips. 30 to 40 people sleeping in the hall. This is a great source of income for us during the winter months, but clearly we can't do that just now. Do you have any advice on how we might work towards being able to safely host such groups? Brian and Yvonne, do you want to answer that one?
Well, the first thing to say is I don't know that those groups are going to be up and running particularly over the winter months at the moment, given the student situation. However, on the assumption that they are up and running, I would refer back to what Karen said about those being high-risk activities to steer away from. I know that most of I don't know if it's mandatory, but certainly at the moment, I'm aware of all the campsites working with reduced capacities and only admitting vehicles where they have their own facilities for washing and toilet facilities, which would suggest that, sort of communal toilet washroom facilities that you might have with camping or a larger group like that would be not so much out of bounds as the wrong term, but would be a higher risk. So I don't know that it's something that's really going to be something we could work towards at the moment, unless others have different ideas on that. I would suggest that falls into the high risk category that Karen mentioned. It's a large group in a small space, sleeping, obviously breathing out overnight, and as I say, they're not going to have individualised toilets and shower bathroom facilities. So my thought would be that while it is unlikely that we will see those groups over the next few months, where they do spring back up again, it's not something that village halls should enter into lightly. It would certainly be a reduced capacity situation. I totally appreciate the source of income, especially for those in Cairngorm and Grampians, but I can't see that that's something that would be safely manageable at the moment.
Thank you very much. Yvonne, I've lost you from my site. Are you able to unmute yourself and add anything to that? I know Yvonne's been having trouble with internet, so I'm wondering if I've lost her.
There's a really good point, Ian. Anthony has made a good point on the chat there about universities teaching online. That would obviously tie in with things like outdoor centres and D&D expeditions and that sort of thing. And those plans are up in the air at the moment, if not suspended entirely, from what I understand, certainly for organisations like Outward Bound and so on. So I would think the same restrictions that are being taken into consideration by the likes of Outward Bound, colleges, unis, high schools would apply here as well for those same reasons.
Thanks, Brian. There you are. I see you now, Yvonne. On you go.
I've actually got nothing really to add, because I would imagine it's way too high risk for any hall to consider for well into next year, because of all the things that Brian went through. There's just no way they can social distance and provide the safety washing requirements that's in it. It's unfortunate for halls if they rely on that as their business model to meet their income. Maybe there's a way they can look at hiring a hall to local groups for other activities, develop a different angle to keep them generating some income through this time that's safer and less risk for a committee, because there is no easy answer to that one at this time.
I want to really wind you up, Yvonne, and say something about why don't we just do it all in camper vans, but I'm not going to talk about camper vans coming to Caithness.
I have no objection to camper vans.
It's Patricia here. Can I just come in as well? I'm not entirely sure it would be a permitted activity either at this point in time. Yeah. We've just had a revised in household contacts, and the Scottish Government have reiterated that for accommodation providers, so your holiday lets and hotels, they can continue to permit 2 households, 6 persons in holiday let accommodation, but they haven't. That's still in place. So I can't imagine that perhaps a hall offering bedding for 30 people who aren't within 2 households is impossible. And I'm not entirely sure it fits within a permitted activity just now. It was something that definitely would need to be further looked at, but I would heed on the fact that perhaps it should not be considered at all until we are further along in terms of COVID control.
Thank you. We're about halfway through our questions for our guys, but it's likely that they get a little bit easier and a little bit yes and no type questions for the next bit. So, where are we at? Karen and Joe, we'll fire these ones to Karen and Joe for this next one, if that's okay. Hold on, someone's popped up my computer and I'm losing screens. There we go. At what point does a community activity become a social activity and therefore under different restrictions from Scottish Government?
Okay, I want to know who asked this question because it's virtually impossible to answer that one. So, as Joe has said, you know, the community halls, they exist for social activity, whether it's playing music, whether it's reading books, whether it's even doing exercise, whatever it is. So there's a whole wealth of stuff that goes on in our halls, and it's all designed to bring people together, to bring our local communities together. And so from that point of view, it is absolutely a social activity. They're almost all social activities, apart from maybe flu vaccines and giving blood, which I think I would probably exempt from those. I don't find those very social at all. But I guess the person who's asked the question is kind of looking to say, are we guided here by the 6+2? So in terms of social guidance for social activity now, the Scottish Government guidelines have said that, you know, we're down to the 6 people, and it was 2 households, and now down to you can't go into another person's home, and so this is changing all the time and may change again, you know, imminently, depending as things go. So I don't think it's very, it's not helpful, or it doesn't give us any answers to think of it in those terms, I think. You know, clearly a community hall is not run as a commercial business. Our halls are businesses, and they do rely on income generation, some of them much more than others, in terms of all of the activities that they do and the turnover that they have. So they are very much businesses, but they're not classified as a private sector business that is subject to necessarily all the same guidelines and regulations that, you know, pubs and cafes and places where you go. You can't go into music venues at the moment, but you know, should they be open, they would be subject to the same thing as well. That's what this question is probably about, and so I think we just revert back to thinking about the risk. And as I said earlier, absolutely, it brings shudders through me to think about lots of people sleeping in a hall, or even going to an indoor market, to be honest. And I think from that point of view, the only safe way is to wait for a vaccine on that one. But you know, so we're not allowed gatherings of any number at all, and so you have to go through the risk assessment route again, rather than consider what kind of activity it is. And I would urge people again to stay safe and to keep our communities, as Patricia said, and the people who are working, the volunteers who are either paid or unpaid, you know, working in the halls. We just have to go for low risk activities to start off with, and be completely confident that we can deal with those.
Okay, thanks, Karen. Joe, have you got anything to add?
Yeah, I was going to say that it all depends on the activity. That makes a huge difference as to what you can and can't do, because there's some activities that take place in village halls that may be permitted or permitted within reason. So I would really advise people to go and have a look on, and now I know it's the SCBO website, we have it on our own website, but we can post as well. Ian will be able to send out the links, but there's a lot of different guidance for different activities. So quite a lot of the activities that take place in our village halls could be considered under community learning and development. And there's very specific guidance for community and learning and development activities. So I would say, if you're trying to make that judgment call, have a look to see if there's guidance about it. So sports activities, there's very strict guidance around that. You know, so take a look at the guidance. You know, if you're looking for a line in the sand, there is no line in the sand of one or the other. It's very much the activity and what that activity is permitted to do in the guidance. But come back to it again, it's what the village hall committee are actually comfortable with, and that risk as well.
Thanks, Joe. I just want to add something on to that as well, Joe, if that's okay. And I don't mean to be rude to the person that submitted this question or accuse you of anything here, but the one bit that I've picked up a couple of times when Jason Leach has been speaking is when he's used the expression, please don't try and find ways around the regulations. And I fear that's a bit what's behind that question. If we could call it one thing rather than another, the restrictions don't apply. My advice to you all the way would be take the safest approach, not the riskiest approach. But that would be a personal opinion. Okay, I'm going to move on.
Ian, sorry, can I just come back on that? So I know you've put in the link to that Jason Leach video, which is fantastic. But also the other thing that he mentions in that, which is assessing risk, is around people. And he specifically mentions it's quite it's a very sensitive thing. So there are a group of characteristics that they will increase risk of people of getting the virus, and these are around age, I think is the top one, weight, being overweight is another, having pre-existing conditions, and then the ethnicity in terms of BAME that has become apparent during the pandemic. So that's other things as well. When you're talking about activities, people are, you have to assess the risk of the people you're doing it with. So and that's why you can have younger people doing contact or non-contact sports in there, and that's lower risk. But if you have a group of people who are all in the higher age category doing like the knit and natter or whatever it might be, lunch clubs or anything like that, then again that automatically puts people up. It becomes a higher risk activity.
So no sumo wrestling allowed in any hall is what we're saying, really. Sumo wrestling is banned. Yeah, go ahead, Joe.
I was just going to say, I actually did one of those personal risk assessments on myself this afternoon before we came in, and I'm at medium risk. So, and they are very interesting because they do put them into different age categories. So I'm hoping that I can work out how I can put the link in the chat for everyone so you can go and have a look at them, because they're even just doing it for yourself. I need to stay at home and not move from my house. So yeah, it reminds me of an old joke, Joe, that some guy realised that most people die in their own home, so he moved house. But we won't go into that one today. Anyway, I'm going to put a question to Barry and Patricia. If you guys are still online, many of the halls only have cold water in the toilets. Is that going to be sufficient in meeting the regulations for hand washing and reducing risk?
Not a bandwidth for my video, so I've had to switch it off. Yes, I think it's the use of soap and water is obviously our primary protection route to keep our hands clean. If you've only got cold water in your hall, then I would hope obviously that you're not producing any food there in the first place, because obviously you would need hot water for washing your hands in a food scenario. But certainly for protection against COVID, provided you're using a liquid soap, then soap and cold water is sufficient. I'd also suggest, and again, it keeps coming back to the risk assessment, but you'll find out when you look for these things that informing people is obviously one of the more important things. So there are posters that you can print off and put up in the toilets to advise people how to do it. And you can print them off from the HPS website or the FSS website and put them in on the doors, on the walls of your toilet, so that people are informed of what they're expected to do to wash their hands.
Thanks, Barry. I maybe just will clarify that a wee bit, Barry, that in quite a lot of the halls, they've only got like a wall-based water heater that's in the kitchen. So they have hot water in the kitchen, but not in the toilets. It's cold water that's in the toilet. So I think that was really what was behind the question. If we've closed kitchens down, is it okay still to have cold water hand washing only? And I think you've answered that by the liquid soap answer.
Yeah, no problem.
All right, thank you. Okay, let me find my place back in our questions. Again, Joe's maybe addressed this one already. So Yvonne, I'm going to pass this one to you. NHS are asking a number of village halls if they can use the village halls for delivery of flu vaccines. Is that is that okay? Would that be permitted, do you think?
Yes, if the whole committee have got their risk assessment done, which NHS would like to see anyway before they considered using your hall. Also, the NHS will have their own strict protocols in place, and I would expect that if the hall is letting the NHS use the hall for flu jabs, then the hall would have to manage if they'd done any other lets at the time. We'd probably have to cancel that because there'd be too many people in the building at once, so the hall might have to consider what else they've got on in the hall. Will allow time for cleaning if there's something else on later. They'd have to consider managing their hall bookings that it wouldn't impact in any way, or they'd have to change it. But the NHS protocols would absolutely make it clear that it would be safe to allow them in to do so. So it's something that halls should consider, and I would imagine that the trustees and the committee would feel that that wouldn't be high risk, but they'd have to consider the other lets in doing so, and managing them and managing time for cleaning in between, just to ensure everything is safe.
Okay, thanks, Yvonne.
Okay.
Yeah. Any other partners want to jump in on that one? Okay. Some school halls are actually being used for schools to provide PE classes. Is there any special measures that would need to be taken in regard to schools and PE? Joe, do you want to answer that one?
I think we've answered that throughout when we've been talking. It's the risk assessments, and as Brian said, the schools will have their own very rigorous risk assessments. So very similar to what Yvonne's just said, you know, it's the whole committee seeing the schools seeing the halls and that. But Brian may be actually more qualified to answer that question.
Thanks, Joe. Yeah, having taught in schools that use village halls for PE, I know that the risk assessment was obviously pre-COVID was rigorous for that in terms of both the risk assessments and insurance cover, and tied in with COVID, as I think Karen mentioned, for sports under 12, it's primary schools, secondary schools tend to have their own facilities. So you're looking at primary schools under 12, they are considered low risk for so contact and non-contact sports. So I wouldn't have thought that would be a problem at all.
Okay, I've got a question I don't think that we're going to be able to answer next. So I've not nominated this to any of the panel, but the question was around: is our insurance still valid during this time, and would the hall be held liable if someone contracts COVID at an event in the hall? Sandy, I'm going to ask you if you've had any response back to this in a second, but we've been trying really hard to get a hold of Zurich Insurance today to try and get some view from them, and so far we've not managed to get a response. Sandy, there's not been anything come in since we've started the meeting, has there?
No, I phoned them a few days ago and sent them an email as well, and I've still not heard back from either. So if I hear anything, I can pass it on to Ian. He can send me information. Okay,
I don't know if anybody else has got a view that we would want to share in this one, but we were unable to get a share. Okay, Karen, on you go, and then Brian.
Sorry, Brian.
No,
probably going to say the same thing anyway. So quite a lot of the halls are in Highland are insured through Zurich after the Highland Council passed over to them, and I know that some of our halls in my area in Bay Trust, they have had specific conversations with their insurers, and I would urge everybody to have that conversation about their particular case and their particular hall. The only thing that I wanted to add really is that it's come to our attention down here that some of the insurers are saying that insurance conditions change if the halls are not open. So similarly, when you insure your own home, you get questions about, are you not away from your home more than, I think it's three weeks at a time, and you're in your home for the majority of the year. And it's a safety thing, I guess, from that point of view, because if you're not in your house, then if there is a flood or a break-in or some other things that are more, the risk is higher. If there is nobody in the premises, then insurers will look at that in a different way. So, and it may also affect your premiums. So if halls are not opening at all for any reason, then definitely get in touch and let your insurers know, because it may invalidate insurance if the hall is not used. But even if you are using it, even for a few bits and pieces, the blanket advice is just ring your insurer up and talk through with them about your specific case. It'll be the same advice that they will give to almost everybody, but I think it's really important that you have that reassurance and that you don't fall foul of it and find yourself on the wrong side of insurance, which is nowhere that anybody wants to be. Thanks.
Thanks, Karen. Brian?
That's Karen said it right at the start. We were going to say the same thing there. We've had to do that for our premises at voluntary action because being out of the building was going to invalidate the insurance. So we're now dealing with them on a rolling basis to keep extending it for 30 days at a time. And it's very much a case-by-case basis. Zurich, I do know, obviously Sandy's still not got hold of them. I still not got hold of them. They're snowed under. They are snowed under, so talking to them on a case-by-case basis is tricky, but it's the best thing to do to try and actually get through and speak to an individual. But Karen's absolutely right. Your insurance could well be invalid for your village hall if you haven't negotiated that extension.
Okay, question 13 out of 15. So we're getting close to the end of this, guys. Has or could the Scottish Government be contacted by HTSI or another body on behalf of the Highland halls to ask for more specific guidance? Or where is the best place to find up-to-date information on guidance? So I'm going to answer that one myself, guys, if that's okay. And the answer is no, HTSI has not been in touch with the government to do it. And I would not propose that we do it. I actually think that there is more guidance out there than you can shake a stick at. So I'm going to cut and paste some pages into the chat room right now that you might want to take a copy of. There is a number, sorry, somebody's just put in a message about Zurich Insurance right now. So let me just have a quick note at that. Thank you. Yeah, if you can do that, Marvin, that would be really helpful as well. Again, if you want to send that to me at the end, we'll actually copy it in with a note of the meeting. So I'm going to put in 2 or 3 links from the Scottish Government website and a couple from the SCVO website. And in particular, the SCVO website one, in a couple of the areas that they've answered questions, there are actually little videos from Jason Leach, and I would really, really recommend them. They're really helpful. And I mean, there are no points for this one, but I guess that you might guess that the most common words that's going to be used throughout them is risk assessment. And so if anybody hasn't picked up that risk assessment is probably going to be one of the most important parts of this, then you've probably been in a different meeting for me. So let me try and do that in a minute or two. Okay, next question. Is there any funding available to buy equipment or stuff like that? Joe, do you want to answer that when I'm trying to cut and paste this lot in, and then I'll come back to another answer as well, if that's okay?
Yeah. As you all may know, there's new funding that's just been released, and it's for many different things. I think the one place that you need to do is go to the SCBO website, because they've got links to all the relevant COVID funding, and have a look at that. For the equipment, I know that the emergency funding that was just that happened previously 6 months said it couldn't be used for equipment, but I know that there's groups looking out there to actually pull together to actually get equipment as joint applications. So what I would say is have a look at it, but see in your area, if you're looking at, is it a fog machine or something like that? What fog? Yeah. So I know that there's some groups who have all come together, put in applications or pulled the money to buy it themselves and share it across the area. So I would say go and have a look at the SCBO website, and again we'll put the links in the email. I know that Ian will collate them all so that you can actually go and have a look at them. And if there's anything specific, again, your rural partners come and ask us, and we can try and find it for you as well.
Thank you. I mean, the only thing that I would suggest or ask a question, and I suppose I'm really asking this of the partners, if people did want to look at doing some sort of collective funding bids, would you guys be up for doing that on behalf of a number of village halls, a bit like some of you have talked about? I know Yvonne's already done this, so I'm going to ask Yvonne to come and talk to us about that in a minute. I know you've mentioned that you've done it through the wind farm money, but where she's actually bought a number of these fogger machines and now let them out to village halls to be able to use them. So I know Sandy had been trying really hard to get in touch with First Port over the last couple of days to try and get a view from them if they would welcome sort of collaborative bids for that, but we've not been able to get a direct response. Everything I can see on the online pages say that they would be open to that. So I think it's something that's worth pursuing. But partners, Yvonne, do you want to tell us what you've done in Caithness, and then maybe other partners, you can jump back in and tell us if you would be up for doing collaborative bids or not. Go, Yvonne.
Okay, right, you can hear me?
Yeah.
Okay, well, we've got quite a few wind farms in Caithness, and we work quite well with wind farm funders. So we put in a bid. Our first project was for community facilities such as our own office in Wick and different community facilities in Caithness to get sanitizer pumps, signage, taping for the floors, and zaptizer machines. And they're really good for rural transport, for vehicles, for community organisations that have their own minibus. It deep sanitises, and they're really simple to use. So that was our first bid in for community facilities and rural transport and community minibuses. Our second bid that we'll be putting in next month is for village halls in particular. That was our pilot to see how it worked, because village halls are not really opening to full capacity yet. So my next bid next month will be to do a similar project for village halls that want to be involved, and I'll be ordering hand pumps, tape and signage for all the halls. And at the moment they can borrow our zaptizer to see if it's suitable for them. It's actually worked out quite well. Quite a few other community groups have asked to borrow it, because there is quite a huge expense to it, but it's worth it, because otherwise funders would get 10 individual applications for the same thing. So by Caithness Voluntary Group being the umbrella body that bids in, it's a much simpler process for all the groups involved, and it seems to work really well. So we'll be on phase 2 next month. So it's really worth speaking if you've got local funders. You know, if you've got any community benefit wind farms, they're much local panels. They understand the issues, particularly for village halls, and they're keen to support them in any way they can. So speak, if you've got local funders in the area, speak to them. And also the Highland Council, I don't know in other areas, but in Caithness, they're a COVID bid fund which wasn't fully spent. So I'm in discussions with them, could that money be used if, you know, we put a bid in for somewhat for village halls? Because there was so much money out there for COVID in the beginning, And a lot with smaller grants, there just wasn't the same take up, or not in Caithness anyway. So always worth speaking to Highland Council to see if they've got any spare COVID money floating about.
Okay, thank you. So
Okay.
let me just run round each of the partners, and I'm really putting you guys in the spot right now, so I'm really sorry about that. I mean, would you be up for doing joint bids if that's what people around your area were wanting to do?
Yes, certainly.
Yep, Joe?
Our area is huge. We could not have one Zaptizer and share it around from Kayak down to Shieldbridge. So, but in the pockets of areas where the community response has been, so like Lochal, Skye, Westeros, South Westeros, then we could help groups come together and do a bid, you know, and put it in. We could help produce that bid for them. But it depends on what it is. If it's owning of an asset, then that's going to be very difficult for us to own and share. But we could help groups do pockets.
Brilliant. All righty, thank you. Okay, and this is us on to our last question, and then I will open it up to the partners to say anything else that they want to, or add anything else in, and then we're actually going to look at a wee evaluation thing, but I'll come back to that. So again, some of you partners have already got this and some of us do not. So the question is, could we set up peer-led support groups so village halls can support each other, share information with each other and set similar standards? Now, I know some of you have already got these groups already set up and some of our areas don't. So I'm going to come to you first, Yvonne, and then you, Karen, because I know you've got them already set up and you can maybe give us a wee update on them. So Yvonne, then Karen.
Yeah, Caithness Village Hall Federation's been running for many years and it's great. It's a great resource. Caithness Volunteer Group facilitates it, and up until COVID, we had meetings 3 or 4 times a year. And the benefit was we would visit each hall throughout Caithness. So we would visit different halls and then they would host the meeting. And really Caithness Volunteer Group's role in it all is facilitating it and inviting a guest speaker along if that's what halls would want. We've had various funders come, people from the Highland Council, we've had environmental health in the past, and who else? Fire safety officers, and people talking about insurance. So it really is. And then the best bit of it is they just share each other's information and support each other. I just have to organise the meetings, and really they take they take care of themselves, because when someone's got an issue or a question, chances are someone from another hall's already dealt with it. So it's a really good way of village halls communicating with each other and sharing information. It's a great success, and it's not a huge amount of work. And it did stall a bit at the beginning of COVID. We had one last month and we're having our next one in October. So it's just a matter of communication with all the halls, and they support each other. And we just, as I said, we just facilitate it. And it's a really useful thing over the years it's developed. And it's nice to see everyone's halls. I think that's another good thing as well. People get to know each other in a community and how the halls run. So if anyone hasn't got one, it's well worth looking into in your area. Would your halls like to have such a thing? Because it definitely peer support that they offer each other is very valuable, I feel.
Brilliant. Okay, Karen?
Hi, thank you. Yes, nothing really to add. We do have a Village Halls Forum in Badenoch and Strathspey. Don't meet as often as that, as Caithness do. We tend to meet once a year, but obviously during the current crisis, we've had certainly a lot more contact with the village halls through the forum. But I agree with Yvonne. It's you know, it's always good to have people who have a similar purpose. They're going to have similar issues. And have the opportunity to share information. So it's a good thing to do.
Okay. Brian?
We don't have a forum down here in Lochaber for village halls, but and I don't think there are as many of them as active as there are in other areas, but we would certainly be open at Voluntary Action Macabre to trying to facilitate such a thing if that was required. We'd certainly we've got all the contacts, so it's something that we could certainly try and set up, and be more than happy to do that if there's demand for that. Not a problem.
Brilliant. Joe?
Ian, could I just...
Sorry, somebody was speaking. I couldn't see who it was.
Sorry, it's me, Ian.
Yeah.
I just wanted to come in on this because a couple of people in the chat have asked about Easter Ross and Inverness, if there's groups similar to that. And as far as I'm aware, there aren't. But
No, there are not, Leah. I was checking that up with In This Together.
Yeah.
And they do not have a list, so
Yeah.
I'm quite keen to set one up for Inverness and Nairnshire, and another one for Easter Ross and Mid Ross.
Yeah, that's what I was going to say.
Brilliant, thank you. Joe, have you got one in Skye?
We don't have one for the area, but more than happy to facilitate it. We did attempt to set one up a few years ago, but just because of the size and the nature of where we're positioned in the area we cover, we may need 3. We may need one for Skye, one for Lochoush, one for Westeros, or one for Skye and Lochoush. But if anyone has an interest in doing this, then my contact details will be in the meeting notes. Just let me know, and we can facilitate something to start off online in the areas that people feel are much more for their area. So if you feel Westeros is yours, or Skye, then we can build it around what the communities want.
Brilliant. And yeah, I just again just reiterating what Leah said. HTSI. I mean, I don't know how many of you will know this. I don't want to get into this in big detail right now, but HTSI has merged with In This Together that covered the Inverness and Nairnshire area, and we've taken over from Rossshire Voluntary Action. So we're very new as a team that's in this, and we would be very keen to take this forward with you. So when we put our notes out, I'll put out our email addresses again. If you would like this to be set up in Rossshire or in Inverness, then please drop us a wee note, and we'll see where we go from there. And that's us come to the end of our questions. So I'm going to run round each of the people who were on the panel again and ask them if they want to add anything else on. And then Leah's going to come and speak to us a little bit about an evaluation of this meeting as well. So, Joe, anything else you would want to add?
I'd just say, as a Village Hall committee, don't sit there alone. We're funded by the Scottish Government to provide free support services, and that includes 2 village halls. So if you need help, contact us. And if we don't know, you've seen today we've got an amazing panel, an amazing network of partners and rural partners across the Highlands. There'll be somebody in from the HTSI and the rural partners who'll be able to help. So just come to us.
Okay, Karen?
No, nothing else to add. Thanks, Ian, though it's been a really, really useful forum, I think.
Thank you. Barry from Environmental Health, anything that you would want to add?
Just very quickly, the risk assessment idea, I think if you're not familiar with it, it can seem daunting, but there is a lot of information out there. Certainly the Scottish Government are putting out a lot of guidance. There's a lot of information from the Health and Safety Executive, and I think what I've seen from this meeting, you have a huge resource here amongst all your members that can help each other. So you're not going to be doing anything that no one else hasn't done already, or isn't also struggling with. So I think it'd be good for you to just kind of work together on that one. That's all.
Thanks, Barry. Patricia, anything else you would want if you're still here? I know you were having to leave early.
That's all right. I'm still here. Yeah. No, it's a very useful conversation. It's great to see so many of you online as well to try and work on getting village halls reopened. Just a final word, really. I suppose you might not get it right first time in your risk assessments. You might realise that you might want to tweak certain things as how you run the hall. That's all part of the course. You might do a desktop risk assessment, and when you actually put it into play, you might realise things don't work out quite as you planned, or you realise another hazard arises. And it's all about just reviewing and reflecting and updating your procedures and protocols as you go through. And the more the more lets you have, the more times you have the hall open to use, you'll experience what works and what doesn't work and what needs improving. And I think if we get any useful information, we'll maybe come to yourself, Ian, and email you some documents and links as and when they might be useful for your members to share.
Right. Christine, I know that you were not actually on the panel, but I see that you're still here online. Have you got anything you would want to add from a Sutherland point of view, Christine? No, I think she's not there anymore. Oh, are you there, Christine? No, okay. I know that Christine wasn't able to attend the whole meeting, but she has dropped out and in. So any of you from Sutherland, Christine is going to be your contact for that area. Yvonne, anything else you want to add? Nothing else? Okay. Brian, anything else from you? Nothing?
No, nothing from this end, thanks, Ian.
Just before we go, I just wanted to sort of wrap up the meeting and just say thanks on behalf of HTSI. My name is Leah and I'm the TSI Services Manager for the Innermurray Firth area. So that covers basically from the Dornoch Bridge down to Inverness and Nairn and some other bits and pieces. And we've, as Ian said, we've kind of taken on some new areas for us. So that includes the work of Ross-shire Voluntary Action and In This Together. So we're now kind of doing the work in those areas. So that's just happened in the last few months. Obviously, it's been quite a big change, particularly as this has all been happening through COVID as well. So we are quite a new team, but we're here to try and help as much as possible. But I think today was a great example of the partnership that we have across the Highlands with ourselves covering the whole of the Highlands, but also our local partners who've helped us from Caithness, from Skye, from Lochaber, from Badenoch and Strathspey, and from Sutherland. It's great to have all of you on board and all the expertise that you have, and groups that can go to you and have, amongst you years of experience. So I think going forward, it's a strong basis for us working together. And in terms of some of the questions that were in the chat, we'll if we haven't answered anything, then we'll follow that up in the notes that go out. We'll send out the recording of this for those who maybe couldn't make it, and also links that were put in the chat. And if there are groups who are interested in those areas, sort of East Ross, Mid Ross, Inverness or Nairn, that are interested in getting involved in a similar sort of group to the ones that have been suggested, with like a network of village halls, then we're certainly happy to get involved and help sort of facilitate that where possible. So just to say, we also have some free training that's available to members at the moment, and I'm just going to put something in the chat. This is something that we produced a couple of months ago, but I think it's still relevant. And one of them is around the return to work, it's called, but it's actually about organisations going back and some of the things that they need to think about. So about the risk assessments that we've heard today, about signage, about making sure that all your users are aware of what's going on. So if on that link you can access some free training. There's 40 different courses, but there's one specifically on returning to work. So if you're interested in that, follow that link or get in touch with us at a later date. But just to say thanks again for everyone for taking the time, because it's been quite a long afternoon and a lot of information, but really, really vital information at this particular time. So hopefully we'll see a lot of you again in the future at different events. So thank you.